Welcome to Masterpiece Women. This is Tina Raines, and I'm the founder of Masterpiece Women, and I am so excited to have you here today. We are a community of authentic women from all over the world, growing together personally, professionally, building businesses and ministries together. And today you're going to hear from a great speaker. So grab a cup of coffee or your favorite tea and sit back and grow with us. Thanks for being here, ladies. Well, hello, Masterpiece Women.
Hello.
Dr. Sheetal Maharaj is with us today. We're so excited to have her, and we're just so thankful for her and for her organization, Impact Sharing and Impact Health Sharing, correct?
Mm-hmm. Yes.
So they're one of our great sponsors and have been just so instrumental in helping Masterpiece with our vision and our growth. And so we're just very thankful for you, number one, but you have so much value to add. I, of course, love you for many reasons, one of which is you're a nurse, fellow nurse.
Yes, that's right. So, team nurse.
Dr. Sheetal is a doctor in nursing. And so I would love to hear a little bit about you and about how did you decide to go that path?
So I started off as a registered nurse, working locally at Holy Cross Hospital, loved it. Decided to go back to school to get my master's degree to become a nurse practitioner. And part of the program at the school that I was going to was that they offered a BSN to DNP, a Doctor of Nursing Practice. And I took advantage of that, did that, and kind of happy that I did because I feel like it gives you a little bit more of an option. Nursing is a fabulous career that I would recommend to anybody. It's not for everyone, but it's a great career nonetheless. There's so many different things. It's not just bedside nursing. There's so many different avenues you can get into with nursing and get your foot through the door. So I went, after I graduated with my doctorate degree, I worked in orthopedic surgery for a little while, and then went and worked back to Holy Cross in cardiac electrophysiology, which I love. And then this opportunity came about working at Impact as their medical director. I've known the Chrysler family for a very long time, and I love what they were doing, what they were kind of doing for the community and what they represented. And I felt like it was a good opportunity for me. You know, we all have different stages of our life, and being a mom, you know, healthcare can be very challenging. And so, especially with your schedule, I mean, and so this was better for me. So I'm glad to take the jump into a different aspect of healthcare, but still kind of keeping my foot in there nonetheless.
Absolutely. And have you always had a little bit of an entrepreneurial spirit to you?
Yes, definitely. Even with, you know, with nursing, always trying to look at different avenues and things like that, taking some healthcare business classes and dabbling here and there with like management. But yeah, definitely always had an entrepreneurial spirit and knew that I wanted to kind of dabble a little bit more in that for sure.
That's awesome. Well, part of what we talk about with Masterpiece Women is so much about how do we build businesses, how do we build organizations of value and high integrity. And I don't know of anybody that does it better than the Chryslers. I've known them for a very long time now. I want to say about 15 or 20 years, somewhere in there. And I've watched even her father. That's how we met, was we were serving at the Boys and Girls Club. And what an amazing family. And so, yeah, you're in a really great place to be working, and we're super excited to be a part of it. And I think from a practical perspective, I owned my own company before and had, you know, in nursing, had 8 offices around the country. So we had to go out and get a big major healthcare plan, and it was expensive. It was very expensive. And the longer we went, the more expensive it became. I remember starting, now this is going to age me a little bit, but like at $200 a month and per person. And so I'm like, okay, I'll pay that. But then it escalated to 800. And to the point when I sold my business, I literally said, okay, I will give you $400 a month. You go find an independent plan, because I could get an independent plan for my family for $400 a month. And now those same plans are like $1,000 a month.
Yeah,
So your option, can you describe a little bit about what it is that you actually provide, the services that your
sure.
organization provides?
Sure. So healthcare sharing is not all that new. It's been around for a little while. It's essentially a group of like-minded individuals coming together in order to save money in healthcare costs. So they you pay your monthly share, and once we get those bills in, you submit them, and we use reference-based pricing to reprice those bills to what we consider fair market pricing. And that's the amount that we recommend that you pay if you haven't met your PRA, which is similar to what would be a deductible with insurance terms. And once you've met that, our members actually will pay 90% of your bills and take care of that for you. It's a little bit of a feel-good thing too, because we use a platform that allows members to see exactly where their money is going. So let's say you and your family were to share in an expense, and my money was going towards that, I would be able to see not the details exactly, but that some money went to you. And that way we can reach out and say, I'm praying for your family. We have a platform where people can submit their messaging, thinking of you, hoping everything goes well. So you get that, a little bit of that personalized or
Oh,
more of a
sounds like
human
a
in
great
touch.
community.
Yeah, so I really like that aspect of it as well. Um, Healthcare costs are going up exponentially, and so this is a way for us to save money for our members when it comes to healthcare costs, and we're significantly cheaper than a traditional insurance plan.
Awesome. Well, and from a business perspective, how do you feel like impact, what sets you apart from there's other health sharing type of
Mhm.
organizations and insurance, and sets your organization apart?
So one of the things, and this is one of the things that I really loved about Impact, is that majority of the health sharing organizations that are out there, there's some of them that are great, but a lot of them are faith-based. So they only allow members of a certain faith into their sharing community, which is okay. But what I like about Impact is that we are all inclusive. Anyone from any faith, as long as you're like-minded and share the same sort of ethics and things like that that we have in our guidelines, you're welcome to join in our community. So I really like that aspect of it. The other thing is that I think we have kind of an industry leading platform that we utilize that creates a lot of transparency with where your money goes. You can log in and like I said, you can see I paid this much this month as part of my monthly share, and $10 went to this person and $50 went to this person. And so everything is right there for you to see. So it to me that's industry leading and unlike some of the other organizations.
I love that. I love that. And what propelled the company to start? Do they feel like this is a need and we could just do it better? And
Hmm. So as you know, the Chrysler, well, you know, but maybe the others don't know, Phil and Angela Chrysler, they initially, well, Phil rather, was initially with Team National, which is a direct selling company that they have. And part of their majority of their members were independent marketers. So they weren't getting health insurance through an employer because they were essentially self-employed. And they saw that gap and really wanted to get in there and help those people get some form of healthcare coverage. They knew that the insurance premiums, like you mentioned, were sky high, and that's not always something that everyone can afford. So they figured, okay, let's look into alternatives. They came across health sharing, and instead of just reaching out to another health sharing organization, they thought exactly like you said, we can maybe do it better. And I think that they are. And so they rolled that out initially as with that in the back of their mind to kind of provide healthcare coverage for their Team National family. And then now it's growing to lots of others that are non-Team National. And so we see the value there for sure.
yeah, I think it's an excellent opportunity, especially for small business owners that
Yes.
and there's so many people involved in Masterpiece Women that have small businesses.
Mm-hmm.
And
Mm-hmm.
unless you have a spouse that has a group plan, and even then, one of the ladies has a small business, her husband has a small business. They have
Mm-hmm.
about 20 or 30 employees, but their insurance is like $2,000 a month. it's
Yeah.
astronomical because someone 5 years ago had some really bad, experiences or what have you. And so it's just very, very difficult to get small plans. So I love the
Hmm.
idea. I love
Yeah.
it.
And
And
that's
so,
a part of impact. Sorry, but
oh,
that's
so
a
no,
big
you're
part of
good.
it, that of impact that's growing right now. We do have group offerings that are targeted for small businesses that want to do right by their employees and provide them with health coverage, but they probably can't afford a regular insurance plan because the prices are just ridiculous.
Yeah.
And we come in, and impact, like I mentioned, is coming in significantly cheaper.
I love that. And I know how they work. Their service, I'm sure, is absolutely incredible always
Hmm.
because it has been. And, knowing that they do everything with excellence. And I
Yes.
know that's their intention and their whole, what's the word I'm looking for? In your business, like culture, the culture,
Yes.
culture
Yes.
of excellence. We were just
Absolutely.
talking on another video earlier today, and we were talking about that, about how important culture is
Hmm.
to
Hmm.
really implement a culture of excellence and a culture
Yes.
that is transformational.
Hmm.
So,
For sure.
so tell me a little bit about what the goals are for the organization in the next few years. Are you all over the country? Are you in certain spots, or what does that look like for your organization?
So we are nationwide. We are available in all states except for about 4 or 5 states. But we have members all over, and we also do, plan to grow in the next couple of years. We are a relatively newer company. We're going on our third year, so we're excited about that and introducing new things that we have added. This upcoming year, we have added preventative care. And so we're excited about that. So just looking to really expand and get our offering out to a lot of people that we know need it. Maybe never heard of it, but they definitely need it in their life. So we're trying to just spread the word.
Very nice. And what about Sheetal? What would you say as far as um, advice to the women that are wanting to start a business or looking to start business? What would you, from a personal, aside from even from your organization, like what
Mhm.
advice would you give to women that are starting out in business for first steps?
Well, first of all, I would definitely say try to get over the fear. It's scary when you're taking that step, going from a regular paycheck where you have a job where now you are self-employed and taking on that, next step for you in your career. But just not to be fearful, to embrace the change. Sometimes it can be good. Um, Definitely surround yourself with people that can help you grow. Networking for sure, which is why I love the Masterpiece Women, because meeting everyone at the lunches and hearing what theirs have to say and their advice, and it really is valuable. So definitely networking, aligning yourself with like-minded individuals, not letting the fear bring you down, the fear of failure or whatever. And even if you do not have the results that you want to see immediately, don't let that deter you. Just switch it up. Maybe you need to talk to someone and figure out what they can recommend that you do a little bit different, or just step back and look at it from a bigger picture. But um, that would be my biggest thing, is not to let the fear bring you or hold you back. And don't let failure stop you either.
Absolutely. I don't know about you, but my best lessons ever, ever, ever have been from my failures.
Yes, I
Yeah.
100% agree.
And when I speak, it's not usually my greatest, successes that anybody ever remembers. They could care less. What they remember is the
Yes.
lesson I learned when I tell them from my failure. Oh,
Mhm.
I get
Mhm.
it.
Yep.
And it's usually what they remember because it's so much more impactful. So I feel like God lets us go
Mhm.
through all those
Yes.
difficulties so that we
Mhm.
can then help that next person from having to go through that. So,
Absolutely. Sometimes you just got to go through the storm to get to the rainbow on the other side.
so true. Actually, that's what I
Mhm.
posted today. It's funny you say that. It's
Oh.
the saying I said about the rain. Don't focus on the rain, but enjoy dancing in the rain or something like that.
Yeah.
You know, oh, don't focus on the storm. Focus on enjoying dancing in the rain, you know,
There you
because
go.
we just don't seem to be able to get outside of our head sometimes and think about, and gratitude is so, so, so powerful in every aspect of our lives. It's incredible what an impact it has
For sure.
even from a medical perspective.
Things can always be worse. Focus on the positive for sure.
100%. And so talk to me a little bit about, you guys are sponsors of Masterpiece. How would you say that it's impacted impact health sharing to be a sponsor of Masterpiece?
Well, like I mentioned before, we are trying to get ourselves out there and get our name out there and allow people to become familiar with healthcare sharing. Now, whether or not they join and we turn around and get them into a membership, but at least that they're familiar with what we have. And so I've met a lot of great women, some of them that we are planning to set up some appointments with, small business owners that may be looking at joining, getting coverage for their employees. So we have some of those things set up. But really just getting our name out there, and it's proven to be very, very helpful. A lot of people don't know what health sharing is. So
yeah, excellent, excellent. So what would be one thing you would leave the women with as a practical tool to for next steps for the new year on self-care? You're a nurse, you're all about health, impact health sharing. So you're all about health. What would you suggest that people think about, and some practical ways that they can really do more self-care next year?
Self-care is very important. Being a mom and then working full-time, it's difficult sometimes to set aside a little bit of time for yourself to do something for you, but I think it's extremely important. Sometimes just sitting alone and reading a book or taking a bath by yourself, even if it's just 20 minutes out of the day, or exercising, whatever is best for you. Just kind of clearing your mind, and you'll be surprised at how many things come to your mind, or just freeing up that mental capacity to allow more in. I also find that praying is very beneficial. Just taking that time to hear what, what God has to say to you, and being open to that. Sometimes I get, great answers to problems that are on my mind. And so find the time. It's difficult as women, as entrepreneurs, as moms, but take the time, whether it be 20 minutes or 30 minutes. You'll be surprised how recharged and rejuvenated you feel after.
Absolutely. I couldn't agree more. Well, thank you. Thank you for being with us today. And thank
you for having
to the
me.
Organization for all the support it gives to us. And we look forward to growing with you in the future days. And ladies, if you have questions about impact health sharing, reach out to me. I can give you lots of information, and I'd be happy to share the information. And I'll put it at the bottom of our blog, etc., so that you can reach out and get more information for your healthcare needs as well. So thank you for being with us.
Thank you for having me.
Thank you, ladies.
Bye-bye.